Hi, we're here today with Dr. Jill Kelderman, and she is a pediatric neuropsychologist. And we're going to talk a little bit about her practice, about what she does, and some typical expectations for visits. Hey, Jill.
Hey, how's it going?
Good, good. So, easiest thing, just tell me about what y'all do, what your practice is, and we'll go from there.
All right, I can do that. So my name is Dr. Jill Kelderman. I'm a pediatric neuropsychologist, and I have two other doctors here in my practice who are also pediatric neuropsychologists. And what we do within the world of neuropsychology is focus on brain behavior relationships. So we have a bit more of an emphasis in terms of how the brain develops, how the brain works in a typical fashion, and how it might work when there's different types of disorders that are in play. And then we do a lot of assessment, essentially. So we do testing of different types of cognitive abilities, things from developmental abilities such as language, motor skills, moving into intellectual abilities, executive functions, which include things like paying attention, organizing information, making a plan. We also look at things like academics and day-to-day behavioral functioning. We collect information from parents, we collect information from teachers when we can. We spend a lot of time with the child and use that information to essentially provide a profile of the child's strengths and weaknesses. If there's a diagnosis, we talk about a diagnosis, but we use all of that information to put together a comprehensive treatment plan that can help support any areas where the child is in need. And then hopefully we can use those strengths that we also identify along the way to incorporate into that treatment plan.
Awesome. What is the typical path for a parent that where would they start typically before even coming to see you in the first place?
So a lot of our parents have had a long path, unfortunately, and the stories that we frequently hear. Oh, sorry, let me turn the phone off. The stories that we often hear are that parents have had some a tickle or a feeling that something's a little bit off about their child, and lots of times parents will say since the day they were born. Sometimes parents will say when they were a tiny baby we had concerns. I think a lot of first-line providers often provide a reassuring role and want to ease parents' anxieties and tell them everything is okay, or let's keep an eye on it. Mm-hmm. And while the intention may come from a good place, it's probably not the best approach. Parents, I think, will often talk with other parents or talk with other therapists, maybe with a speech-language pathologist, maybe with early childhood consultants. And then ultimately, they come in our door, but it's usually after they've talked with a lot of different people, with a lot of different types of specialists before they find their way here. Not always. The great days when a 2-year-old comes in who's referred by the pediatrician because there's a language delay and there's some social concerns. Ideally, that's how it would work. And sometimes that does happen that way. But a lot of times parents have kind of been advocating a lot, trying to, I think, make their voice heard to say, something's not right here. And so sometimes there's a roundabout way before they come to us.
Sure. So one of the key takeaways then I get is you don't need a diagnosis to come see you, most importantly.
Absolutely. That is correct. In fact, most insurance companies consider our service to be diagnostic testing. So that's part of what our role is, to identify a diagnosis if it is there, to provide that diagnostic clarification. And it's helpful not necessarily to provide the label, but because if we know where the behaviors are coming from, if we know where the difficulties are coming from, then we can look at what the research tells us about other groups of kids who have a similar type of profile or a similar set of problems or challenges, and use that information to know what's going to be most helpful for this kiddo.
Gotcha. And y'all don't do, it's not strictly ASD, obviously. There's, I'm imagining some variation, some different diagnoses and kids that you work with as well.
That's correct. I do have a specialization in autism. All of the doctors here have pretty broad training. So we see children who have, really any type of neurodevelopmental condition, anything that might affect how their brain develops, or how they're functioning cognitively, how they're functioning psychologically, and how they're functioning behaviorally.
All right, I have to ask you the most basic question.
Mm-hmm.
The difference between psychiatry and psychology.
Good question. It's a tricky one too. Psychologists tend to have PhDs or PsyD. So they're doctorate degrees, but they really specialize in psychology. And we do not provide we do not write prescriptions. We don't send people. We don't say, here's your prescription for X, Y, and Z. We don't prescribe medication. Psychiatrists are MDs. They go to med school and they do prescribe medication.
Gotcha.
So if you want to, and psychiatrists can often, or they can diagnose autism as well as other things such as ADHD, anxiety, depression, things along those lines. So the difference is typically psychiatrists will spend a good amount of time with a parent, do a parent interview and collect information, and spend some time with a child and collect information and use that to provide the diagnosis. And sometimes they'll use questionnaires to get information from the teachers in particular. And then additional visits with the psychiatrist are usually to talk about medication and how the medication is working, and to make decisions together with the family about, do we need to alter or change the medication or try something different. For a psychological, or in our case, a neuropsychological evaluation, they tend to be more comprehensive evaluations where we're getting a lot of information from different sources. And we have the luxury of being able to spend time with families and time with the children. We'll provide that diagnosis and treatment plan. And we may say, for example, we suggest you go see the psychiatrist,
right,
because they may be able to provide some support in terms of medication. And then we may also say, try speech language, try ABA, let's try some OT, whatever it may be. So they are different. And in neuropsych, you may go in and do your initial evaluation, and you may not go back for a year. You may not return for 3 years. You may not return. We love our families, but if you never have to see us again, that's great. Psychiatrists provide more ongoing care because they're continuing to monitor that medication. So that's more of a treating relationship.
And I'll throw my 2 cents in as a parent. The difference that we have has definitely been exactly what you talked about. We had we'll still to a certain extent have a psychiatrist for our one son, and those visits usually tend about Q&A with us,
Mm-hmm.
with Noah, our son, kind of hanging out and doing what he's going to do, but
Mm-hmm.
certainly not the focus. It's more talking about him as opposed to talking to him. Whereas years ago, when we were going to a psychologist and we're doing testing, it was all about the kids. Yes. It really wasn't so much about, how was our experience. It really had very little to do with what we had as input. It was really about the interaction with them and what they were doing, what their challenges were, like you said, and seeing what was actually going on in their day-to-day life. Mm-hmm. So definitely that was certainly our experience with it.
And that's a good point too. And then there certainly will be a difference in terms of the amount of input we rely on from parents versus time with kids, depending on the age and the profile of the individual kid. If we have a 16-year-old who comes in, we can get a lot of information from them, but we still need parents to describe what they're seeing on their end. At the end of the day, parents, probably have a thing or two to say about their child. So.
Oh yeah.